When a person who has COVID-19 is cared for at home, of course, there are two objectives. One is to take care of the patient, and otherwise, of course, is to prevent infection of anyone else in the household. So, of course, the patient needs to be cared for. So, how do you do that best? Designate one person who takes care of the patient all the time. Don't do in the morning the mother and in the afternoon the sister or whatnot. Don't do that. One person takes care of the patient and has to always keep at least a meter difference. Even when taking care of the patient. Keep in mind, when we're talking about home isolation, we're talking about people who are actually not really very sick. Usually these people can actually walk around, they can do all kinds of things because they may be having some cough and a running nose and maybe some fever, but they're not really sick. But it is important that they don't walk around the house, that they stay in a room that is their room, and that ideally is not shared with other people. If that is not possible, then the other people must always stay a meter separate from the patient. In other words, not two people in the same bed, for example. Also, it's important to have a lot of air circulation, so that if the patient, the person who has the virus, coughs, produces droplets, that these droplets basically are quickly brought outside the house. So opening the windows is very important. A lot of air circulation, clean air from outside, so that any droplets that are being produced can easily get out of the house. Also important is that the person who has the disease cannot give the disease to others, for example, through the plates that he or she uses, through the utensils, the forks, the spoons, etc. So the person must eat separately, on separate utensils, separate plates, etc. And they must be very well cleaned every time after use, every time clean. Also, any surfaces that the patient may touch in the bathroom or elsewhere, always clean it very carefully, first with soap, then with an alcoholic solution, just in case there would be some virus there. So these are all measures that are important to keep somebody at home. Also very important is, of course, the wearing of masks, right? If you have somebody in your house who is positive, the patient should wear a medical mask, but also the caregiver, the person who takes care, also wears a medical mask, and it would be very prudent that everybody in the house actually wears a medical mask. There shouldn't be any visitors. This is not a disease where you want to have visitors, so if somebody is positive with COVID, no visitors at home. You want to absolutely reduce the number of contacts that person may have. Importance also of washing your hands. Anything you touch in the house, always wash your hands afterwards, particularly if there's somebody in the house who has COVID. And then also any garbage, any waste that may be produced by that person or even in the house, pack it in a strong bag and get rid of the bag, close it, that nobody else can touch it. All these are small things that are needed if one wants to keep a patient at home who has COVID. It can be done, but it's important to have precautions so that the COVID patient doesn't spread it to others. It can be done safely, it can be done in the comfort of your own home, but these measures that I just described, apply them and then nothing will happen to the people in the same house.